Okay, let's talk a little bit about autosomal recessive inheritance. Let's think about a pedigree chart which illustrates the recessive inheritance pattern. And when we think about autosomal recessive inheritance, of course we're thinking about cystic fibrosis, sickle cell anemia, Tay-Sachs, ketonuria, and Wilson's disease. Lots of things we're going to discuss. But first, let's think about what are the chances for gene expression. So this is a very typical case, and we should know that both parents are carriers, so they are heterozygous, autosomal recessive, meaning that there is a 1 in 4 chance that the child will be affected. If you look at a basic Punnett square and you work it out, there is a 1 in 4 chance, or 25%, that the child will be affected, a 1 in 2 chance that each child will be a carrier like their parents, and a 25% that the child will be totally unaffected. So this is a very basic and clear pattern for autosomal recessive inheritance, and this should be understood before talking in detail about some of the diseases. But let's just talk about some of the examples of representative autosomal recessive disorders. One would be, of course, cystic fibrosis, and this is on chromosome 7. Then there's alpha thalassemia, which is on chromosome 16, beta thalassemia on chromosome, alpha thalassemia is on 16p, and cystic fibrosis was 7q, and beta thalassemia is 11p, sickle cell anemia is 11p, and phenylketonuria is 12q, Tay-Sachs disease 15q, Hurler syndrome 22p, Wilson's disease 13q. Cystic fibrosis is 1 in every 2,500 births, and sickle cell anemia is also very high. Well, it's very high. Phenylketonuria is 1 in every 10,000. Tay-Sachs disease is 1 in every 4,000, and Hurler syndrome is 1 in every 100,000. Wilson's disease, for example, is in 1 out of every 50,000. But anyway, that's just a basic introduction to autosomal recessive inheritance, and let's go into some of the diseases. We're going to start with cystic fibrosis.